You know, it's amazing to think about it, but the All Sorts podcast on YouTube really is like a boundless wellspring of knowledge, isn't it? Every episode, we dive into something new, exploring everything from, I don't know, the mysteries of ancient civilizations to like the cutting edge of science and tech.
And for our listeners, our dedicated explorers, it's all about providing those deep dives, those rich explorations of the topics that really matter.
Exactly. And if you've been with us on these journeys and found them enriching, don't forget that little like button goes a long way. It helps more curious minds like yours discover the All Sorts podcast.
And subscribing, well, that's your ticket to never miss a single drop of new knowledge as we release it.
Oh, and speaking of past journeys, don't forget to check out our archives. We've covered some fascinating territory, and you might just find your next deep dive waiting for you there.
And for those of you who thrive on real-time insights and want to keep the conversation going, be sure to follow All Sorts Podcast on X, Instagram, and Threads. We're always sparking new discussions and sharing those little nuggets of knowledge that make you go, interesting.
Okay, so today we're diving into a topic that, well, it really demands our attention. Obstetric fistula.
And for you, our engaged listener, our mission in this deep dive is pretty clear, I think. We want to really get to the heart of what causes obstetric fistula, understand the truly devastating impact it has on women's lives, and crucially emphasize that this is a condition we absolutely have the knowledge and the means to prevent.
You're right, it is crucial. And the sources we've gathered for this deep dive, they paint a very stark picture. We're talking about a health crisis that's been largely overcome in wealthier nations, but tragically, it's still a persistent reality in so many developing countries.
Exactly, a reality we need to confront.
Absolutely. And to do that, we've drawn on some really valuable expertise from organizations like the International Continence Society, the International Confederation of Midwives, the World Health Organization, and we've supplemented that with some additional insights from Wikipedia and a very detailed clinical review from PMC.
A great foundation for our exploration.
I think so. All right, let's start at the very beginning. For those who might not be familiar with this condition, can you explain what exactly is obstetric fistula?
Well, to really grasp obstetric fistula, it helps to understand the general idea of a fistula first. Just imagine it as kind of like an abnormal passageway, a connection that's formed where it really shouldn't be. And this connection can happen between two internal organs, or even between an internal organ and like the surface of the body.
Okay, so it's sort of like a pathway that's gone astray, connecting things that should stay separate.
Exactly. And these fistulas can form for a variety of reasons, from infections to injuries, even as a side effect of some surgeries. But today, we're zeroing in on a very specific type. Obstetric fistula.
Right, the one directly linked to childbirth. So how does that manifest, specifically in the context of what we're focusing on today?
Well, you see, in developing countries, obstetric fistula is most often a direct consequence of what we call prolonged or obstructed labor. In essence, this means the baby can't descend through the pelvis during childbirth. And tragically, this can sometimes go on for days, even, without any intervention.
Days! Oh my gosh, I can't even imagine how terrifying and painful that would be. And you mentioned that this is something largely absent in developed nations, right?
Absolutely. In settings where we have adequate medical care readily available, where women can access things like emergency C-sections when needed, obstructed labor is usually addressed quickly and safely. And that prevents the whole cascade of events that can ultimately lead to fistula formation.
So essentially, it's the lack of timely and effective intervention that's really at the heart of the problem in these regions.
You've hit the nail on the head. Early detection and intervention are key.
And from a purely physical standpoint, what's actually happening inside the body that causes this abnormal connection, this fistula, to develop?
Well, it all comes down to prolonged pressure. Imagine the baby's head, unable to descend, pressing relentlessly against the mother's pelvic tissues for hours, even days. Those delicate tissues of the vagina, the bladder, the urethra, and the rectum, they just can't withstand that constant pressure.
So that pressure is what leads to the damage.
Exactly. The blood supply to these areas gets compromised, and we call that ischemia. And without a steady flow of oxygen and nutrients, the tissues start to die, which is a process called necrosis. And as that dead tissue breaks down, it creates a hole, the fistula, between these adjacent organs.
That's a very clear, though quite distressing explanation. Our sources also delve into the different types of obstetric fistulas. Can you unpack the key distinctions between them for us?
Sure. As you might guess, the classification really depends on which organs are connected by this abnormal opening, this fistula. The most common type we see is the vesicovaginal fistula, often shortened to VVF, and that's an opening between the bladder and the vagina.
So that would lead to what, urinary incontinence?
Exactly, a continuous leakage of urine. Then we have the urethrovaginal fistula, or UVF, and that one forms between the urethra, the tube that carries urine from the bladder, and the vagina.
Okay, so that one also involves the urinary system.
Yes, it does. And then there's the rectovaginal fistula, or RVF, and as the name suggests, it's a connection between the rectum and the vagina. So with that one, you'd have fecal incontinence, which is, well, you can imagine the impact on a woman's life.
Absolutely devastating. You also mentioned some less common types, right?
Right. There are also ureterovaginal fistulas, which are connections between the ureters, the tubes that carry urine from the kidneys down to the bladder, and the vagina. And then there are vesicouterine fistulas, which connect the bladder to the uterus. These are less frequent, thankfully, but they can still cause very significant problems.
And it sounds like the damage can be so severe that a woman might end up with multiple types of these fistulas.
Unfortunately, yes. In the most severe cases where the obstructed labor has gone on for a very long time, a woman can develop multiple types of fistulas simultaneously. It really speaks to the extent of the tissue damage that can occur.
It's a really grim picture. And shifting our focus a bit, can you give us a sense of just how widespread this problem is around the world?
Well, first, it's crucial to understand that obstetric fistula has essentially been eradicated in the developed world. With access to quality medical care, readily available C-sections, it's become incredibly rare. But the reality in developing countries, it's tragically different.
And the estimated numbers are really quite staggering, aren't they?
They are. Current estimates suggest that there are at least 2 million women and girls, and it's important to emphasize girls, who are living with untreated obstetric fistula in developing countries right now. And it's very likely that the actual number is much higher.
Why is that?
Well, many of these women live in very remote, underserved areas. They face a lot of social stigma around this condition, and they lack access to even basic healthcare information and services. So their cases often go unreported, undocumented. It's a hidden crisis in many ways.
That's a heartbreaking thought. And geographically, where is this condition most prevalent?
The burden of obstetric fistula is particularly heavy in sub-Saharan Africa. We also see a significant number of cases in parts of Asia, like India and Bangladesh, as well as in remote rural regions of China and certain areas of South America.
So we're talking about some of the most vulnerable populations in the world. What are the main factors, then, that put these women at such a heightened risk of developing obstetric fistula?
It's a complex interplay of factors, really a web of interconnected issues. But the most fundamental issue, at its core, is a lack of consistent access to essential medical facilities. Many women in these regions simply don't have a healthcare facility nearby that's equipped to handle childbirth complications. And when you add to that the absence of skilled obstetric care, especially the lack of access to emergency C-sections when labor becomes obstructed, the risk of fistula skyrockets.
It's like a domino effect, one problem leading to the next.
Yes, and compounding this lack of access is the scarcity of resources within the healthcare systems themselves. There's often a severe shortage of properly trained doctors, nurses, midwives, and even when you do find skilled personnel, they're often working with limited supplies, outdated equipment, and facilities that are, well, in dire need of repair.
That sounds like an incredibly challenging environment to work in, let alone to receive care in.
It is, and beyond those immediate healthcare barriers, there are these broader societal factors that come into play, and they contribute significantly to this problem.
What are some of those factors?
Well, poverty is a huge one. Chronic malnutrition, it can lead to stunted physical growth in girls and women, and that in turn can result in a smaller pelvis, making them much more susceptible to obstructed labor during childbirth. In fact, the sources we reviewed highlighted a very sobering statistic. Many women who develop obstetric fistula are shorter than 150 centimeters. That really brings home the impact of these broader societal inequalities.
It does. It's a very tangible link between poverty and this devastating health condition. What about the age at which women in these regions are starting families? Does that play a role?
Oh, absolutely. Early marriage and childbearing, especially among very young adolescent girls whose bodies are simply not fully developed for childbirth, is another major risk factor. A significant proportion of obstetric fistula patients are teenagers. Some studies even report figures as high as 86%, and many of them are having their very first pregnancy, which inherently carries increased risks.
So it's a combination of physical immaturity and the added stress of a first pregnancy that creates this particularly vulnerable situation.
Precisely. It's a dangerous mix. And then there's the crucial factor of education and access to accurate health information. Many women who develop obstetric fistula have had no formal education, so they lack access to essential knowledge about healthcare, family planning, pregnancy, even basic childbirth information. The illiteracy rates we saw on these patients were alarmingly high, ranging from 19% to 96% in some studies.
So without that knowledge, they might not even recognize the warning signs, the danger signs during labor, or understand the importance of seeking medical help, or even know where to go to get it.
Exactly. It's a tragic lack of empowerment. And on top of that, you have certain cultural beliefs and traditional practices that can inadvertently contribute to the problem. In some communities, there might be deeply held beliefs that prevent women from seeking medical care during pregnancy or labor. They might rely heavily on traditional birth attendants who, while respected within their communities, may not have the training or the resources to manage obstetric emergencies. Sadly, many women end up laboring at home for extended periods and are only transferred to a health facility as a last resort when it's often too late for effective intervention. A significant percentage of them actually end up delivering at home without any professional medical assistance at all.
It sounds like a perfect storm of challenges. You also mentioned some harmful traditional practices.
Yes, unfortunately. Some practices like female circumcision or infibulation, or a practice called gishiri cutting that's done in some parts of Africa, these can cause significant scarring and tissue damage in the genital area. And that pre-existing damage can increase the risk of obstructed labor and make obstetric emergencies, including fistula, much more likely.
So we've got this whole web of interconnected factors, from poverty and lack of education to cultural beliefs and harmful practices, all contributing to this elevated risk. Now, I think we need to shift our focus to the truly devastating consequences that obstetric fistula has for women who experience it. What are the most immediate and, I imagine, life-altering symptoms?
Well, the most immediate and probably the most profoundly impactful symptom is the constant involuntary leakage of urine and or feces. It's this continuous wetness and soiling that leads to a very pervasive and very distressing odor.
I can only imagine how humiliating and isolating that must be.
It is. And beyond that, there's the risk of chronic infections, both in the urinary tract and the reproductive system. Kidney disease is another major concern, and then there are the painful sores and ulcerations that develop in the genital area because of the constant moisture and irritation. Dehydration is also a serious risk, and it can even become life-threatening in some cases. The damage to the vaginal tissues can make sexual intercourse either impossible or incredibly painful, and that often leads to secondary infertility. And then, of course, there's the tragedy of stillbirth. In these prolonged obstructed labors, stillbirth rates are incredibly high, ranging from 78% to 96% in some studies. And in some cases, that prolonged pressure on the pelvic nerves can lead to nerve damage, sometimes resulting in conditions like foot drop, which is basically a paralysis or weakness of the lower limbs.
The physical toll is just immense, but the social and psychological impact, I would imagine it's equally devastating, if not even more so.
You're absolutely right. The social and psychological consequences are often utterly heartbreaking. Women with obstetric fistula, they often face such severe social isolation, stigmatization, and discrimination. They might be excluded from religious practices, deemed unclean by their communities, and even rejected by their own families. It's a profound loss of social support, and it often leads to even deeper isolation and despair.
It's hard to even fathom the pain of being ostracized by your own community, your own family.
It is. And often the husbands of these women will resort to divorce or abandonment, leaving them in incredibly vulnerable situations, facing extreme poverty without any social or economic safety net. The grief over losing their child, the inability to conceive again, it creates deep psychological scars. Depression, anxiety, and tragically even suicidal thoughts. These are all too common among women living with this condition. And even something as basic as maintaining hygiene, it becomes an enormous challenge, especially in areas where access to clean water is limited.
It's like a cascade of losses, one after another. They lose their physical health, their social standing, their families, their sense of self-worth. It's truly devastating.
It is. And in some cases, the desperation can become so severe that these women are forced into commercial sex work just to survive, just to have some means of income because they have no other options.
That's just horrific to think about. But thankfully, there is hope in the form of treatment, right?
Yeah.
What are the main goals of treatment for obstetric fistula?
Well, the primary goals are really to surgically repair the fistula, to close that abnormal opening, and to achieve what we call continence, which is basically the ability to control the flow of urine and feces. Ideally, treatment should also aim to restore normal sexual function, to give women back the possibility of having children, and to ensure that any future deliveries are safe. Ultimately, the overarching goal is to help these women reintegrate back into their communities, to help them reclaim their dignity in their lives.
And when treatment is successful, I can only imagine how transformative that must be.
It is truly transformative. A successful surgical repair can dramatically improve a woman's quality of life. It frees her from the constant physical discomfort, the social isolation, the shame. It gives her a chance to rebuild her life. But it's essential that these repairs are done by highly skilled fistula surgeons working in dedicated fistula centers. The success rate is highest with the first attempt at repair, usually around 70–80% for uncomplicated cases, but unfortunately, it drops to 50–60% or even lower for those more complex, long-standing fistulas.
So expertise and specialization are really key. What are some of the major challenges in getting that specialized treatment to the women who need it most?
Well, one of the biggest challenges is that there simply aren't enough locally trained surgeons who have the specific expertise to perform these delicate repairs, especially for the more complicated cases. And on top of that, there are far too few medical centers that are properly equipped to provide this kind of specialized care. The lack of essential medical supplies, proper equipment, and post-operative care facilities, that's a huge barrier. And consistent follow-up care is absolutely essential to ensure long-term success and prevent recurrence, and that's often lacking as well.
And are there any potential complications that can arise either from the fistula itself or from the repair surgery?
Sadly, yes. Recurrence of the fistula is a risk, and it's more likely in complex cases or in cases where the fistula has been present for a long time. Infections are a concern, both wound infections and UTIs. Women can also experience other bladder-related problems after surgery, sexual difficulties, obstruction of urine flow from the kidneys, bladder contracture, vaginal narrowing or scarring, nerve problems, and of course there's the ongoing psychological trauma that they're dealing with.
It's clear that the medical aspect of treatment is just one part of a much larger process of healing and recovery. What about the rehabilitation and reintegration piece, helping these women get back into their communities and rebuild their lives?
That's a crucial part of the process. You see, many of these women have been living with obstetric fistula for years, often in extreme poverty and isolation. So even after a successful repair, they often need a lot of support to fully recover and reintegrate back into their communities. Acceptance by their community, that's so important for them to be able to participate in social and religious life again. They might also want to remarry, have more children, and that can help restore their social standing and their sense of self-worth. Providing skills training and income generation opportunities is also crucial so they can become economically independent and build a new life for themselves.
It's amazing to hear how much of a difference that kind of holistic care can make. But as many of our sources emphasize, prevention is ultimately the most important thing.
Absolutely. While we absolutely must continue treating women who are currently living with fistula, our ultimate goal has to be to prevent this devastating condition from happening in the first place. And the good news is, it's largely preventable if we put the right measures in place.
So what are some of the key strategies for achieving that?
Well, the most critical strategy is to ensure that all women have access to quality maternity care, and that this care is provided close to their communities. This means things like establishing and supporting maternity waiting homes, where women in the later stages of pregnancy, especially those in remote areas or those who have been identified as high risk, they can stay near a medical facility in the days leading up to labor. And of course, access to emergency obstetric care, including C-sections, when labor becomes obstructed, that's absolutely crucial. We also need to invest in training more skilled birth attendants, doctors, nurses, midwives, and make sure they have the resources and support they need to provide high-quality care. Strong national and regional policies that prioritize maternal health are also essential to make sure we're directing resources where they're needed most and holding healthcare systems accountable.
And making sure that healthcare is affordable and accessible, that's got to be a key part of the equation as well.
Absolutely. No woman should be denied essential health care because she can't afford it or because she can't physically get to a facility. Financial support schemes, reliable transportation options, those are all essential pieces of the puzzle. And we need to invest in the infrastructure to support all of this, especially in remote areas where access is most limited. Education is also a powerful preventative tool, especially for girls and women. Providing them with comprehensive health education, teaching them about family planning, pregnancy, childbirth, that empowers them to make informed decisions about their bodies and their health.
It really does seem like addressing these broader societal issues, empowering women, it's just as important as the direct medical interventions.
Absolutely.
Yeah.
And engaging the whole community is vital. We need to involve men, traditional leaders, everyone in raising awareness about obstetric fistula. The more we talk about it, the more we can break down the stigma and encourage women to seek help. It's also important to train traditional birth attendants so they know how to recognize the danger signs of obstructed labor and know when and where to refer women for medical care. Addressing things like child marriage, making sure girls aren't forced into marriage and pregnancy before their bodies are ready, that's crucial. And working to combat poverty, improving access to education, ending harmful traditional practices, promoting birth spacing, all of these things are essential for long-term prevention. It's a multifaceted approach, but it's one that can truly make a difference.
It's a lot to take in, but it's so important to understand the complexities of this issue. It's incredibly disheartening to know that a condition that's been virtually eliminated in developed countries is still causing such immense suffering in other parts of the world.
It is. Obstetric fistula is a stark reminder of the huge health disparities that still exist globally, and the fact that it's preventable, that we have the knowledge and the resources to stop it, makes it all the more tragic that so many women continue to suffer. It really highlights the urgent need for greater awareness, for greater action, for a more equitable approach to global health.
You're right, it's a call to action for all of us. And for you, our listener, we want to leave you with this final thought. Think about those stark disparities we've been talking about. What role do you think we can play, as individuals and as a global community, in ensuring that all women have access to the essential maternal health care they deserve, regardless of where they live or their economic circumstances? It's a question that challenges us to think deeply about our shared humanity and our responsibility to one another. Thank you for joining us on this important deep dive.